Let's take a look at asthma. Asthma is a condition that causes the airways to be sensitive, triggering reactions in which the airway becomes narrow, causing breathing difficulties. Most people with asthma will carry their medication around with them, usually in the form of an inhaler. General information. An asthma attack can be traumatic for the casualty, especially if they are a child. It is important to reassure the casualty and have a calm demeanour. If the first aider does not remain calm or doesn't reassure the casualty, an asthma attack can lead to hyperventilation, even after the inhaler has relieved the constricted airways. There were 78 asthma-related deaths in Victoria in 2021. This comprised of 48 females and 30 males. There were 135 in New South Wales, 52 in Queensland, 26 in South Australia, and 34 in Western Australia. Asthma medication usually takes the form of a blue inhaler. An inhaler usually relieves the attack by dilating the bronchioles and relaxing the smooth muscle. This essentially means the inhaler will relieve the narrowing airways, allowing air to properly pass through. Always ask the casualty about their inhaler to ensure its function is what you require. The casualty's asthma plan will guide you and may include the use of other inhalers. The bluey-grey coloured inhaler comprises of salbutamol. This belongs to a group of medicines called beta-2 agonists, and this is going to help relax that smooth muscle. Some people will use different coloured inhalers, a red one for example, as a preventer. This will help prevent the need for the Ventolin inhaler. However, there are some people that use both the red one and the bluey-grey coloured one during an asthma attack. Always be guided by the casualty and their asthma plan.
Tom has asthma.
Are you okay?
School staff know about this and they carry asthma emergency kits on yard duty in case Tom or other children have an asthma attack.
Hey Tom, you okay? You sound really short of breath. Have you been running around? You're holding your chest. Is it feeling tight? Okay, it sounds like it might be asthma.
The teacher is calmly assisting Tom through the asthma first aid response. Shake the puffer and place into the spacer.
So I'll get you to do 1 puff and 4 breaths.
After each puff, Tom takes 4 breaths. He does this 4 times and then waits 4 minutes to see if his symptoms improve.
Okay, so it's been 4 minutes.
Tom's asthma symptoms settle after 1 cycle. His coughing has stopped and his breathing has returned to normal. Sometimes more cycles will be required. Remember to shake the puffer before using each time. It is essential that staff complete the first aid log in the asthma emergency kit and inform the child's parents or carers.
Okay, well there's the bell. We can take you back to the classroom now, let your teacher know what's happened, okay?
Asthma triggers. There are many varying things that can trigger an asthma attack. This can be different for different casualties. So the common triggers can be food, colds or infection, air pollution, smoking, house dust mites, weather, emotions, pollen, molds, fungi, exercise, animals, medicines, and hormones. Smoky days and asthma storms. There is a possibility that a casualty that has never had asthma may have an asthma attack during an asthma storm event. So during an asthma storm, whole pollen grains get swept up into the cloud as the storm matures. Moisture in the cloud fragment the pollen into smaller pieces. Dry, cold outflows carry pollen fragments to ground level where people breathe them into their lungs. Some pollens can burst open and release tiny particles that are concentrated in the wind just before the thunderstorm. These small particles get further into the airways and can trigger asthma symptoms. If grass pollen is a problem for you, then thunderstorms in spring and summer may also affect you. Be aware of asthma storms from October to February. There are some very useful apps that can help you predict and be prepared for an asthma storm event and help to track air quality. Melbourne Pollen is a good one, as is Air Radar. Vic Emergency tracks and publishes information regarding thunderstorm asthma from the 1st of October to the 31st of December. Signs and symptoms. The following signs and symptoms may be present during an asthma attack. Mild to moderate signs and symptoms include breathing difficulties, coughing, wheezy breath sounds coming from the lungs, tightness in the chest. Severe and potentially life-threatening symptoms may include pale, clammy, sweaty skin, cyanose lips, difficulty speaking more than a few words in a single breath, and altered conscious state. The following signs and symptoms may be present when a child is struggling to breathe. Chest contracting above their collarbone, chest drawing in below their rib cage. Look for unusual movements in this area. Abnormal breathing sounds, grunting, wheezing, or high-pitched sighs. Signs of shock, pale, weak, decreased muscle tone, cold and clammy. These signs of respiratory distress can be evident in many other cases, including anaphylaxis, croup, pneumonia, infections, COVID, partial choking, injuries, drowning, and smoke inhalation. If you notice any signs of respiratory distress, urgent medical attention is required. Treating a casualty for asthma. The 4x4x4 technique is an easy to remember guide to administering asthma medication when there is no asthma plan to follow. It basically means your casualty is going to have one puff of medication followed by 4 breaths. You're going to repeat this 4 times and then wait 4 minutes and reassess your casualty. This is most effective when a spacer is used. Always remember to shake the medication between each puff. You will have the opportunity to practice these skills during your face-to-face class time. Always remember that if the casualty has a written action plan, always follow their action plan. If there is no written action plan, then you can use the 4x4x4 technique. So always start with doctor's ABCD. You're going to sit your casualty upright or lean them forward. Assist the casualty in using their medication through the spacer if available. If it's not available, you can use the medication without a spacer. The medication should be administered using the 4x4x4 technique. If the attack is severe and there is no improvement after 2 attempts of the 4x4x4 technique, call it 000 for an ambulance. Continue to perform the 4x4x4 technique until the ambulance arrives. It's important to note that it is important that you do not take the casualty out for a breath of fresh air, as the cold air can worsen the attack. Try partaking in light casual conversation. This can help the casualty feel calm and take their mind off the attack. And be prepared to carry out resuscitation. These are examples of asthma action plans. Your casualty may have one, and if they do, absolutely follow the plan. If they don't have an action plan or they're not able to produce it, use the 4x4x4 technique. If you need an ambulance, they will guide you. Anaphylaxis. Anaphylaxis is an extremely dangerous allergic reaction. It is caused by a massive overreaction in the body's immune system. Though there are many different types of triggers, severe anaphylactic reactions are rare, and not every allergy will become anaphylaxis. General information. Intolerance. An intolerance can make a casualty feel unwell, but intolerance does not involve the immune system. Intolerance can produce the same symptoms as an allergic reaction, but are generally gradual in appearance and don't cause major issues. It is a localized reaction with no systemic effect. It's going to affect where the substance touches and usually not outside of that. An example of this is a lactose intolerance or a sensitivity to food additives. In these cases, the intolerance involves the digestive system, not the immune system. An allergy. An allergic reaction is an immune system response to a certain substance. It can affect multiple body systems. An allergic reaction may only cause minor discomfort and require oral antihistamine to remedy. Anaphylaxis. Anaphylaxis is an extremely dangerous allergic reaction. The name anaphylaxis means without protection, and indeed the condition is caused by a massive overreaction of the body's immune system. During an anaphylactic reaction, the mast cell releases large amounts of chemicals, including histamine, into the casualty system. The mast cell responds to the immunoglobulin attaching to the allergen. Histamine is only one of the chemicals that are released by the mast cell, so an antihistamine is going to have a very limited action against an anaphylactic reaction. An anaphylactic reaction causes the blood vessels to dilate. It's going to drop their blood pressure, cause them to go into shock. It can constrict the bronchioles, and this is going to make it very difficult to breathe. It'll make the capillary walls leaky, adding to the shock and causing swelling, and it may cause the skin to form a rash and become itchy. Allergens. Now there are common allergens, and these can include milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, soy. Can be caused by bites and stings, including bees, ticks, ants. Could be caused by medication. Then you have uncommon allergens. These can include cold, exercise, latex. There are so many different allergens. Signs and symptoms. Now the signs and symptoms of an allergic reaction can include hives, welts, body redness, swelling of the face, eyes, lips, but this swelling will not cause an airway obstruction in an allergic reaction. Tingling around the mouth, vomiting, abdominal pain, diarrhea. Now in an anaphylactic reaction, your casualty is likely to have difficulty breathing, swelling of the lips and tongue, swelling and tightness of the throat, difficulty speaking, hoarse voice, wheeze or persistent cough, dizziness or collapse, and in young children you might find that they become pale and floppy. In order for me to say that this is an anaphylactic reaction, I'm looking for three main symptoms: swelling and tightness of the throat, difficulty breathing, and shock. Vomiting and abdominal pain can be signs of anaphylaxis caused by an insect sting. Allergic reaction. Signs of a mild to moderate allergic reaction can include swelling of the lips, eyes and face, hives or welts, tingling around the mouth, abdominal pain, vomiting. Treatment usually includes taking an oral antihistamine. There are many different types. If you're not very sure if your casualty is having an allergic reaction or an anaphylactic reaction, treat for anaphylaxis. Anaphylaxis can become very dangerous very quickly. Treating your casualty for anaphylaxis. Firstly, you're going to lay your casualty down. If they're conscious, lie them on their back. If your casualty is unconscious, then lay them in the recovery position. Allowing the casualty to sit up suddenly or stand can result in the casualty's blood pressure dropping dangerously low and insufficient circulating volume. Walking, standing, or sitting suddenly has been linked to fatalities. Reassure the casualty to help them stay as calm as possible. This may aid in their breathing. Medication administration information. You're going to check the expiry date and fluid window. This will be present in both an EpiPen and an Anapen. If the medication is out of date or the fluid in the viewing window is not clear, the auto-injector is still safe to use and is better than nothing. You will have an opportunity to practice using an auto-injector during your face-to-face class time. We're going to talk about EpiPen first. When administering an EpiPen, you're going to read the instructions on the EpiPen. Check the expiry date and fluid window. You're going to remember blue to the sky, orange to the thigh. Check the site you intend to administer the EpiPen for injury and obstruction. You can go through one layer of clothing. Remove the blue safety cap. Press the orange tip on the upper outer thigh over a single layer of clothing until you hear the click. Hold for 3 seconds and release. Check the time. An EpiPen or auto-injector can be administered every 5 minutes if needed. Always follow the casualty's action plan if they have one. Make sure to call an ambulance as soon as you recognise the casualty is having an anaphylactic reaction. Administering an Anapen. The Anapen is going to have directions on the side, and it's important that you read those directions, check the use by date, and check the fluid window. The instructions are going to tell you to pull off the black needle shield. You're going to remove the grey safety cap from the red button. Place the needle end firmly against the outer mid-thigh at a 90-degree angle, with or without clothing. Press the red button so it clicks and hold it in place for 3 seconds.
This video shows how to use an Anapen to help someone having a severe allergic reaction known as anaphylaxis. Follow the instructions on the Askia action plan stored with their Anapen. When someone is having anaphylaxis, help them to lie down. If they are having trouble breathing, help them sit up. If they become unconscious, place them on their side in the recovery position. Each Anapen has a red button with a grey cap at one end and a black needle shield at the other end. First, pull off the black needle shield. This will also remove a small grey needle shield. Then pull off the grey safety cap from the red button end. Hold the Anapen in your fist with your thumb closer to the red button end. Place the needle end firmly against the outer thigh of the person's leg, halfway between the hip and the knee. The Anapen works through a single layer of clothing. Press the red button down firmly with your thumb until you hear a click, and hold in this position while counting to 10. Then remove the Anapen and put it to one side, being very careful to avoid the exposed needle. Call 000 immediately and ask for an ambulance. Stay with the person and keep them calm. When possible, place the large black needle shield back on the Anapen to cover the needle. Keep your fingers away from the needle at all times. Do not allow the person to stand or walk at any time. The person must stay in hospital for at least 4 hours. For more information on allergy and anaphylaxis, visit our website or call us on 1300 728 000. Or visit the website for the Australasian Society of Clinical Immunology and Allergy.
It is important that you call 000 for an ambulance as soon as you recognise the casualty is having an anaphylactic reaction. It's worthwhile calling an emergency contact. The casualty will need to go to hospital. Stay with the casualty and monitor their condition until the ambulance arrives. If you're in any doubt, administer the adrenaline autoinjector. Commence CPR at any time the casualty is not responding and not breathing normally. Choking. One of the most important skills a first aider can have is learning how to treat choking. Objects such as food, sweets, or small objects can easily become lodged in the airway should they be breathed in rather than swallowed. In the following slides, we will teach everything you need to know in order to learn this vital skill. Signs and symptoms. There are many signs and symptoms that indicate someone is choking. These include wheezing, stridor, difficulty breathing, coughing, cyanosis or a bluey grey colour forming around the lips, unable to breathe or speak, gripping at their throat, agitation and altered conscious state. Types of airway blockage. Partial or complete airway obstruction will cause a person to choke. If the person is able to cough, speak or cry out, it means their airway is only partially obstructed. Understanding this allows you to identify what type of obstruction they are experiencing and the best way to help. Each type of choking requires a different way of treating. Common tactics like patting someone's back may actually cause a partial airway obstruction become a complete one. Treating an adult casualty with a partial obstruction. Lean the casualty forward as far as possible. Encourage the casualty to cough. If this doesn't work and the casualty is becoming distressed, call 000 for an ambulance. Monitor the casualty closely and wait for further instructions from ambulance personnel. In the event that an adult has a complete obstruction, you're going to call for help. Bend the casualty forward so their head is lower than their chest if possible. Give 5 sharp back blows with the heel of one hand to the middle of their back between the shoulder blades. Remember to check if the obstruction has cleared after each blow. If the obstruction still hasn't cleared, place one hand in the middle of the casualty's back and the heel of the other in the CPR compression position. You can also lean the casualty against a high back chair or against a wall or something solid. You're going to give 5 chest thrusts. Remember to check if the obstruction has cleared after each thrust. If the obstruction still has not cleared after 5 chest thrusts, shout for help and ask somebody to dial 000 for an ambulance. If you're on your own, now's the time to do that. Do not stop treatment while the casualty is still conscious. You're going to have an opportunity to practice these skills during your face-to-face class time. If the casualty is a child or a baby and they have a partial obstruction, call an ambulance immediately. It's best that they're on their way because a baby or a child doesn't have the oxygen reserve that an adult has. Place the child in a steep head down position over your knee or over your arm. Encourage them to cough and monitor the child closely until the ambulance arrives. If the child is suffering from a complete obstruction, call 000 immediately. Lay the casualty over your knee or support them in a steep head down position. Give the child 5 firm back blows between the shoulder blades. Ensure to check to see if the obstruction has been cleared after each blow. If that hasn't worked, turn the casualty over or sit them up. Give them 5 chest thrusts. Ensure to check to see if the obstruction has been relieved after each thrust. These chest thrusts don't have to be as hard as CPR. They only have to be a quarter of the same pressure. But these chest thrusts are very productive and is likely to work. Keep repeating instructions 1 through 5 until the obstruction is relieved or the child becomes unconscious. In the event of an infant or a baby choking, dial 000 for an ambulance immediately. If the baby has a partial obstruction, they might try to cough or cry. You're going to lay them in a steep head down position and let them cough. This may relieve the obstruction. If the baby has a complete obstruction where they're unable to cough or make any sound, lay the baby over your arm, again in a steep head down position or across your legs. You're going to give them 5 sharp back blows with the heel of one hand in the middle of their back. Ensure to check to see if the obstruction has been relieved after each back blow. If that hasn't helped, turn the child over and using 2 fingers on the baby's chest, give them 5 chest thrusts. Chest thrusts are very similar to chest compressions, but they're sharper, they're not quite as deep, and they're delivered much more slowly. If this still hasn't helped, you're going to repeat steps 3 through 5 until the obstruction is relieved or the baby becomes unconscious. Now it's important to remember that grapes and cherry tomatoes are right at the right size to block a child's airway, so it's a good idea to cut them in half until the child is 5 years old.